What is going on in here? It's like a whole big gunk of pus.
We're actually in disbelief that Candy is actually managing to walk at all. There is so much pus and discharge, crunchy, cruddy bits.
Come on, Candy.
Hello!
Hi, good morning.
Morning!
In Sydney, Alison and Audrey's first patient is rescue cat Candy. Carer Adriana has some grave concerns about the little orphan.
So what's wrong with Candy today?
So I run a cat rehoming service, and she's come into our care a few weeks ago with very poor balance. She was very unsteady on her feet.
Oh, look at your eyes.
So when she walks, she has a head tilt like this. Her head wobbles like one of those wobble toys, and we don't know why. We originally thought that was because of malnutrition. So we've been feeding her. She's now reached a really nice weight.
She has, yes.
But her balance is getting worse, and she falls when she walks, and it's very sad, actually. She was down in the euthanasia list, and we thought that perhaps we'll be able to help her and hopefully find her a home.
We're just going to see how Candy's walking, see how she's placing her feet.
And that's
what she does?
That's what she does when she just can't concentrate enough to walk.
My sweetheart. So she's in a wide space and she's not liking it, but I think if we pop her close to the cupboard, she might actually be a bit better. Just to have that security of something next to her. She's more comfortable to walk.
Yeah, because she uses that to
balance herself, yeah. Well, this definitely could be neurological because of the head tilt. An inner ear infection is another possibility. So there's a couple of tests that we have to do today. So we're just checking her placement. So I'm actually popping her paw the other way and see if she can right it herself. So this is one of the exams that we do just to check her nerve function to all her feet. Good girl. And so she corrects it straight away, which is a very good sign. So let's have a look in her ear. There's quite a lot of gunk in there, so we'll see. Might just look clean.
What is going on in here? It's actually sort of a thick mucoid yellow colour in here. It's like a whole big gunk of pus.
We're actually in disbelief that Candy is actually managing to walk at all. There is so much pus and discharge, crunchy, cruddy bits. It must be so uncomfortable and painful for her.
It just looks so nasty.
As soon as we put anything in her ear, her leg starts scratching and she starts shaking, so it's quite uncomfortable. It's almost like it's quite hypersensitive to any sort of stimulation.
So the ear is actually a very important part of what we call the vestibular system or the balance system. So if the ear is affected, especially the inner ear or the middle ear, that will really put you off your balance. You can't stand straight and it just makes you really dizzy.
The girls need more clues that will help explain Candy's condition.
So we've smeared the ear discharge onto the slide and you can see it there. And I'm going to give that a stain up, so put a few stains on it and have a look down the microscope to see if we can see any yeast or bacteria that might be causing the infection.
Alison is shocked when she makes an alarming discovery in the little cat's badly blocked ears.
There's a lot of bacteria there, there's a lot of pus and white blood cell. It looks like a bad infection, so we'll take Candy into hospital under general anaesthetic, give it a good flush out.
The best case scenario for me would be for her to find a cure to her problem and then find her forever home.
Carer Adriana wants to find Candy a loving new home, but the little cat's chances will be slim unless the girls can find out why she can't stand up or walk straight.
So let's take her back to the hospital.
And then hopefully we can get to the bottom of the infection.
You are not good right now. Okay, let's pop you down here. It's a nice corridor. So she's circling to the right. You can see she's actually bending towards the right and she'll actually do some small and big circles as well.
The girls suspect her badly infected ears could be the reason why she's struggling to stand up straight or walk properly.
The worst case scenario with her is that it's actually a brain problem. You know, if there's something going on, she was born with a brain defect, that would be very difficult for her to live a normal life. It's pretty distressing to see how she's walking because she obviously looks quite dizzy and disorientated. And because she's so young and she should be playing and happy, it does make you really sad. It's heartbreaking.
So we're just going to give her general anaesthetic, and we're also going to take some blood just to look at her general health screen. Whoa, I did not expect that.
Okay. You're not liking the noise. That's fine. That's fine.
I think it was the noise, eh?
It was a noise.
The frightened little rescue cat is terrified of all the attention, but she urgently needs an ear flush to help relieve her pain and hopefully improve her balance.
So we're wrapping Candy up just so that she feels a little bit more secure and hopefully she doesn't jump out of our hands while we're taking blood.
I think because she's so uncoordinated in any position that she feels a bit uncomfortable or dizzy, she freaks out. So having sort of that pressure around her is going to make her feel a little bit more settled.
Taking bloods with a very flighty cat can be a little bit dangerous because you're with a pointy needle and they're running around the room. So you've just got to work around the cat, figure out a way that they're most calm and also keep the bitey end and the claws ends in, away from us. Good girl. You might get better line down. And I got a...
This is
give me a fright every time you do that.
0.7, yeah?
Yep. So looking at the red, so the globulin is slightly elevated, sitting at 55, normal's 51.
Yeah.
And that isn't unexpected because usually that would go up if there's inflammation or infection.
Yeah.
So whether that inflammation or infection's in the ear or is it in the brain, we're going to have to get to the bottom of that and find out. So we're going to pop this little tube in just so we can get right down into the ear canal and then use some special flush with some antibiotics in it to give it a really good clean. We do have to be really careful because the end of that can cause some damage because it is so inflamed in there. So just guiding it in with my otoscope gently to get it to where I need to. All right, so we've instilled that in. Okay, maybe I'll have another quick look down before we start flushing.
The girls are now worried that the severe infection in Candy's ear is so bad it may have spread to her inner ear and dangerously close to her brain.
As I go deeper, I can actually see the eardrum has a massive hole in it.
Yeah, it's huge. Wow, she really doesn't even have an eardrum at all.
The kind of white shiny membrane that you would normally see covering the end of it is actually torn in half and there's a big black hole through it. So I think we found the reason why she can't walk straight and she just hasn't got any balance. I would guess it's probably a really nasty infection that's been left for too long and that tympanic membrane or eardrum has just ruptured. Did you see it?
Yeah, it's huge.
Poor thing. Awful.
In some way, this is bad news because she has got a very deep, severe ear infection that's been long-standing. But in other ways, it is good news because we can fix that.
Candy's ears are so badly infected, she's been unable to stand up properly or walk straight.
So now we're flushing out her ear, we're getting rid of all that crust and crud and pus, just trying to give it a really good clean out to get rid of all the bacteria there.
Oh. Why do we always get the gory ones?
I know. All right, final check. Let's have a look. That is so much better. The oxygen's gone really low.
Yep.
I'm just going to give her a couple of oxygen ones.
Sasha is not taking a breath now.
More. Yes, more breath. So she actually stopped breathing for a little bit. We've just given her a couple of breaths of oxygen. She stops breathing, her oxygen levels are going to drop, and that's really dangerous for her heart and her brain. So very important to keep an eye on it and address things quickly. She's back on.
So an eardrum will repair over time as long as you've got rid of all that infection and inflammation. These are just some antibiotic ear drops and they're just going to clear up the infection and hopefully fix this problem. And then give it a bit of a massage, get it all the way down. Okay, should we wake her up? So it will take some time, but the good news is it will repair. All right, let's put her to bed, let her have a little rest, and then we'll get you home to Mum.
Here you go, kitty.
I'm Dr. Kate Adams and welcome to Bondi Pet, a new destination for pet health and well-being. Our site is filled with everything to fulfill your pet's needs so that you can make healthy choices for your pets. I'm Dr. Kate Adams and welcome to Bondi Pet, a new destination for pet health and well-being. Our site is filled with everything to fulfill your pet's needs so that you can make healthy choices for your pets.